morning. I'm Sabrina Lowell, Advisor and Chief Operating Officer of Mosaic Financial Partners, and I'd like to welcome you to our presentation on the Affordable Care Act, ACA, and Medicare Enrollment Made Clear. Before I introduce our speaker, Jim Holt, a few housekeeping items. During our session today, Jim will share prepared remarks along with corresponding information on the ACA and Medicare. What do you need to know? What's next? And while we have time set aside at the end for Q&A, we do encourage you to ask questions throughout. Today's webinar is being recorded, so if you have a friend, colleague, or a family member who wasn't able to attend, the presentation will be available on our website following the broadcast. At Mosaic, medical coverage needs are an important piece of the comprehensive financial plan, and Jim has worked with a number of our clients on helping them navigate the healthcare landscape and also to get proper healthcare coverage in place. So now I'd like to introduce Jim. With nearly 30 years of experience in the insurance industry, Jim is an RHU and an REBC, and the primary focus of Holt Financial Services is medical insurance planning and consulting for individuals, for the self-employed, and also for business owners. So Jim also works with individuals on Medicare regarding Medigap plans, Medicare Advantage, and Part D planning. So please, help me in welcoming Jim Holt.
Thank you, Sabrina, for having me back. I was here before ACA was implemented last year, so it's been a long year. a lot of questions have come up. There's a lot of information out there. There's a lot of misinformation. So hopefully today we'll try to clear up some of those questions that people have.
Great. And, in speaking about that, give us a little preview of what we're going to talk about today.
Well, today we're going to talk about Affordable Care Act or Obamacare or ACA. Those are all interchangeable terms. Some people know what Obamacare is more than anything else. So we'll talk about that. We'll talk about Cover California, how Cover California, what they are actually, and why we need to use them in some cases and not in others.
Okay.
We'll talk about enrollment, open enrollment, special enrollment, tax credits, tax subsidies, what those are. We'll also address, some people want to know why my individual plan might be cheaper than a group plan. We'll talk about the pros and cons of individual coverage versus group coverage, or advantages and disadvantages of each.
Okay.
And then we'll get into Medicare, talk about how to enroll in Medicare, the different parts of Medicare, parts A, B, C, and D, what they all mean. Talk about supplemental plans. We'll talk about open enrollment for Medicare, which is different than open enrollment for ACA. So all those issues we'll try to get to today.
Okay, great. Yeah, a broad array, but covering everything that one might need to know.
Right.
And before we jump in, and as you alluded to, it's been a year since you've been here, and we do have a recording from last year on the basics of ACA and Covered California. But for those attendees who might not have been with us last year, just a brief synopsis of what is ACA and Covered California.
Okay. Well, ACA is the Affordable Care Act. That was signed by Obama back in March 2010, which was basically healthcare reform. Finally fully got implemented January last year. So that's kind of what Obamacare ACA is. Cover California is really the state entity that implements ACA in California. So they're really a government agency. They're not an insurance company, but they are important in terms of for tax credits and all that. Because one thing you can get if you want tax credits or tax subsidies, which are really the same thing, you have to apply through the Cover California mechanism to get tax credits. I kind of equate Cover California like a Costco, a big warehouse, and you go into the warehouse, you give them your application with all your information, they look at it and say, based on what you've given us, you'll qualify for $500 in tax credits. Now you can go down to Kaiser, you can go down to Anthem, or you can go down to Blue Shield and sign up in the kiosk down the hall. But if you don't qualify for tax subsidies, you don't even have to walk in the building. You can go to Blue Shield or Anthem or Kaiser down the street directly, and you just sign up for the plan. But if you want the tax credits, you need to apply to Cover California to get that, and you pick your plan through the Cover California website.
Okay. And the important piece for those listening is there are the different metallic plans. And
right. That's the change. All the new ACA compliant plans are all metallic levels now. There's bronze, silver, gold, and platinum. It just means how much benefits are covered. It's doesn't
Mm-hmm.
bronze is the least expensive and has the least amount of coverage. Platinum is the most coverage and is the most expensive.
Okay.
So when you compare a bronze plan with Kaiser to a bronze plan with Anthem, they're actually pretty equal. I mean, one's an HMO, one may be a PPO, but what they cover have to be similar. There's certain requirements to be at that metallic level. So it makes it a little bit easier to compare plans to carriers if they're the same metallic level. That was part of the, I guess, the reason to come out with metallic plans was try to make it easier, because before you had so many different plans, you didn't know how they compared to each other. At least you know if you got a bronze, it's very similar coverage-wise to a bronze with a different carrier.
So it makes it easier to compare across carriers. People know what they're going to get if they have a platinum versus a gold versus a silver.
Exactly.
And some of those additional nuances that you talked about last year are available on the recording.
Right.
So you alluded to the fact that you'll touch on group versus individual plans, but give us a sort of an overview of what have you seen changed in the landscape? You know, what's going on within the ACA and Covered California?
Well, I mean, one thing that happened is we still have grandfather plans. Grandfather plans were the plans that you had before Obamacare was signed back in March 2010. So if you had that plan, with some carriers, they let you keep that plan, and you didn't have to change to a new ACA plan with a metallic level. So some people still have those old plans. It could be on a group basis. Some of the individual carriers allowed you to keep it. Some of them didn't allow you to keep it. So some people have the new ACA plans that are one of the metallic levels. So that's out there now. In terms of the tax subsidies, those are working now. If you applied to Cover California and you met the requirements, we'll talk about details of the income levels to qualify for tax subsidies, and so we'll get into more details later on. But that's part of the landscape now. So we've had just a lot of changes.
And so speaking of that, what are some of the problem areas within the ACA implementation? Inevitably, there have been bumps along the way. From your perspective, what are those?
There's been a lot of bumps. As I tell clients, I the 6 months of open enrollment from October 1st to like April 1st last year was that I've had more problems in those 6 months than I've had 25 years in the business combined.
Wow.
There's been numerous problems. One big problem is carriers' lines are jammed. You can sit on hold 2, 3, 4 hours. That's much better now. You can talk to a carrier much sooner. That may change when we get to open enrollment again, which I'm not looking forward to that. One big problem has been provider networks are a lot smaller for some of the carriers. Anthem and Blue Shield both have smaller networks, so people were on the bigger networks on individual plans, and then they got moved to the new ACA compliant plans, and that actually was a smaller network. And so their doctor may have been in the bigger individual network, but that wasn't available to them anymore. They only could go with the new network, and that their doctor, if you didn't sign a new contract, he would be actually out of network. And so that was a big problem with some of my clients. They went to their doctor and found out all of a sudden their doctor didn't take Covered California plans, which really isn't the problem. The problem is the doctor doesn't take the network of the carrier. It's not Covered California. It's really the network of the carrier.
For the individual plan through Covered California versus a doctor that they might have been going to previously that was within their network on the group plan. Yeah,
if they're in a group plan, they may have been in it. But people that were on individual plans, they say it was Anthem, which Prudent Buyer was their individual PPO network. As of January 1st, all new Anthem plans that were non-ACA compliant were using Pathway, which is a different network. So those people that were on Prudent Buyer got moved to Pathway whether they wanted to or not. They didn't have a choice about it.
A new network.
Yeah.
So before we sort of go on to the next piece, how should one go about checking if they're moving over to Covered California, if their doctor is going to be still included in the new network?
Right. I mean, the best way is actually go to the carrier's provider. You can use Covered California's quoting system, but I just go directly to the carrier. It's the same network, whether the plan is a Covered California plan or it's directly with the carrier. It's the same network, the same plan, the same provider network, the same cost. They actually, by law, they have to be the same. The carrier may have some additional plans that are not part of Covered California. That's okay, but if they're in Covered California, those plans they have to offer outside of Covered California, and they're identical.
Okay.
So that was what's confusing, was that you could really buy the same plan directly with the carrier.
Directly with the
carrier. If you wanted the tax subsidy, you had to buy it through Cover California.
Got it.
And another problem we ran into is probably not quite as obvious, is the formularies, which are the preferred drug plans of the carriers, have shrunk down on the individual marketplace. The area that carriers have some control over their expenses is how much they pay providers and what drugs they will cover. And so they may have a fewer number of drugs on their formulary, maybe not as many of the expensive drugs, and that's how they get their costs down also. And that's not quite as obvious to a lot of individuals, that they may not have, the drugs they're taking may not be available on the new plan.
And so are you seeing that both with individual and group plans, or really on the individual coverage side?
It's actually can be on the group side also. The carriers have offered smaller networks and smaller formularies on the group side, but you can buy the bigger network and the bigger formulary on the group side. You can't do that on the individual side. That's probably one of the differences between group and individual, is you actually have a lot more choice on the group side.
Yeah. So anything else that people should be aware of through Covered California or with the new ACA?
A couple things that are going out. Covered California is sending out letters to a number of individuals who are signed up through them. One is citizenship verification. Some people, they couldn't verify their citizenship, so they wanted proof that you were a citizen. If you're here legitimately, so you need to send the proof. If you didn't send that information back to them by September 30th, they're going to terminate your coverage. You probably, if you got that letter, you would have received it by now. They send it out like the first week of September.
Okay.
So that's an important thing to
And
know.
that's new.
Yeah, that's new. So you just need to make sure. Some people may want income verification, that they can look at your tax returns for 2014 to verify the tax credits, that you're getting the right amount of credits. And if you didn't give them verification to look at your tax returns, they would not give you any more subsidies. So that's also important to respond to that.
Interesting. So speaking of open enrollment and going into next year, now that we're a year in with 2014 implementation, what are some of the changes that you're aware of for 2015?
A couple of things. I mean, well, rates are going to go up. That's kind of given with health insurance, but actually that's not. The average rate increase in California, California projects, is going to be 4.2%, which is all plans all across the state.
Both individual and on average group plans?
This is individual.
Okay, individual.
But it can be, some carriers might actually have some of a rate decrease, and some may have a rate increase over 10%. But for most of us, we've seen rate increases 10, 15, 20% over the last number of years. So something in single digits actually is better than what we've seen. Cover California is getting control over some of the costs and all that. So, but it's taking the time. So it depends on what carrier you're on and where you live, what you're really going to see. So that's probably one of the bigger changes that are coming up. Also, you're going to find that when you do your taxes in 2015, Cover California is going to send you what's called a 1095A. It's just like a 1099. This is a report to you of how much tax credits you got per month, what the premium was, how much credits they gave you, and so you have to give that, and that information goes
to your CPA or your tax preparer.
Yeah, so there's all new IRS forms that are being developed, and it hasn't been, I don't think it's been finalized by IRS yet. There's some specimen forms that are being reviewed to see what's going to happen there.
So that's interesting. So 1099s go out typically by mid-February for custodians on the investment side. Do we know what the timing of?
I would think that they'd probably have a similar requirement, but I'm not a tax expert, but I just know they're generating new forms to show what the tax credits that people received are, because they're going to look at that, and that's going to be, I think, a huge issue that is going to surprise a lot of people. All that's going to be reported to IRS, and if it's different than what they thought it was going to be, they may owe money to the government. Well, they may get some money back too. Depends on if they underreported or overreported their income. So interesting. A couple other things that are happening for 2015 is, one problem is on the, like Blue Shield, they have the EPO product, which is you can go in network, but if you go out of network, you have no benefits. And some counties had EPOs, and the problem Blue Shield has, if you went outside the county, you had no benefits unless you had emergency care, which is very restrictive for an EPO, and that's created a problem, I know, for some of my clients. So they want to get out. Blue Shield is going to make it a little more lenient next year. Is you can go to the preferred providers out of county have benefits. You still have no benefits for non-contracted providers, but you're not restricted to have to stay in your county. That's been very restrictive.
So are these for emergency services or services in general? So if you're traveling and you have a major incident,
right.
You would still be covered, or this would also pertain
it's
to
emergency services only.
Okay.
But I have a client. Her doctor had offices in Oakland and Contra Costa County, so she could go to the doctor in Oakland because that was in the EPO network. But if they wanted to go to the Renda office, which is in Contra Costa County, they wouldn't be covered.
That's an interesting nuance. That's an interesting nuance.
I guess Blue Shield got a lot of flack back, and so they're going to expand that option. Another thing is going to happen is HealthNet, who has mainly PPO plans throughout the counties. Some counties it's going to become an EPO plan, so it's going to go the other way.
Okay.
The thing I don't know is if you're on PPO this year, are they going to make you go EPO, or is this new enrollees? I called HealthNet, and they couldn't tell me as of yesterday.
So more to come on that.
More to come on that, yes.
Okay. When is open enrollment for Covered California, and is there a special enrollment period? Talk a little bit about that.
Open enrollment for Covered California and for all carriers. This does not cover California. Open enrollment applies to all insurance companies. It's going to be November 15th through February 15th, so it's going to be a 3-month window. The initial open enrollment last year was 6 months because it was all a rollout and all that, so they gave more people time to try to figure it all out and get signed up for a plan. Now open enrollment is going to be condensed down to 3 months. I've read that it might, I hate to say this, might be worse than 6 months I went through, just because it's more compressed time period. Hopefully a lot of the technology glitches that they had are ironed out. Carriers hopefully are staffing up for more phone calls. There was, the carriers were hanging 2, 3, 4 hour waits. Or we would call our offices. We had the same waits as the general public. We couldn't get through any faster than they could. So hopefully that's going to be resolved to some degree, but the carriers are hard pressed because there's a lot happening during open enrollment, because open enrollment for Medicare is going to be happening during that time, and open enrollment for a lot of small group plans is going to be at that time. So carriers are going to be very hard pressed to meet all that's going on this last quarter.
So people, if they're not already on let me rephrase that, if they're already on a plan, they can make a change during the open enrollment period. But if someone is moving off a group plan, so if they have a change in employment status or a change in general status, getting married, getting divorced, special circumstances, what is their special open enrollment period?
They can do that any time. They have like 60 days from the change of status.
Okay.
So open enrollment is 3 months. Special enrollment is for people outside that open. If you're outside of that 3 months window, if you have this loss of coverage, your COBRA runs out, you get laid off your job, you move to another state, those are all opportunities where you can sign up outside of that open enrollment period.
So just like if you're working for an employer, you have your open enrollment period, you make changes during that period. Otherwise, you can make changes throughout the year for special circumstances.
Right, exactly.
Talk a little bit about who can receive tax credits or subsidies for Covered California. You mentioned that you can go, if you're on a plan, on an individual plan, you can go directly to the carrier, or there may be some instances where you do want to go through the Covered California website.
Right. I think if you go to the next slide, because there's a breakdown of trying to make this chart as simple as possible. If it's based on the federal poverty line, so if your income for yourself or your family is below the 138% of the federal poverty line, only thing you're going to get offered is Medi-Cal. You're not going to get offered any tax subsidies or credits. That's been a big problem in other states that don't have Medi-Cal expansion. People don't qualify for tax subsidies, but they can't get Medi-Cal. In California, we can get Medi-Cal. They expanded, and so if you're below 138%, you'll be offered Medi-Cal as your coverage. If you're between 138% and 400%, that's the sweet spot for the tax subsidies. So the lower you are on that spectrum, the more tax credits you'll qualify for.
And where I think we've found that we've had some traction around that are for clients' children who may be newly independent or off to college and are no longer associated with their parents' tax return, so they have a lower income or no income bracket.
Well, sometimes if their income is too low, again, they may be offered only Medi-Cal, and that's it. So the trick is, and the numbers are about $16,000 for an individual. So if your income is below $16,000, you're going to get offered Medi-Cal, and that's it. So there's several tiers. I mean, if you're between 138% and 250% of the federal poverty line, there's actually two types of tax enhanced. There's an enhanced benefit and there's the tax credits. Tax credits are as if you get that, if your premium's $300 and your credit's $150, you get billed $150 by the carrier, and the carrier gets the other $150 from the government. But if you're between 138 and 250% of you also can get enhanced benefits where you get actually lower deductibles and lower co-pays, and there's like 3 different levels. So depends which level you follow, what benefits you get. So that's actually one reason the silver plan, about 65% of the people have gone silver. Probably a big reason is because to get the enhanced benefits, you have to sign up for a silver level plan. You don't get enhanced benefits if you sign up if you want platinum or gold. So even if you qualify for the enhanced benefits, if you don't select silver, you won't get the better benefits. A lot of times it's actually better taking enhanced benefits
and then to be able to be eligible for the tax credit.
Right.
Got it.
And then one other thing that people aren't aware of is if your household income is 250% or less, you can get tax credits, but the state will only offer your kids Medigap. You can't get the tax subsidies if your household income is below 250%. Now that's a lot of people weren't aware of that.
So, and just for those of you in the audience, this chart, as well as all of the slides, will be made available following the presentation. There's a lot of good information here, and I think just to tag on to what Jim's saying is it's different for everyone, so going through and actually running the numbers is probably the way to be able to see, are you eligible or not?
Right. So if you're AGI, if you're above the 400% level, that's why you don't need to go to Cover California because you're not going to qualify for any tax subsidies or tax credits at all. So I always kind of ask people, what's your age, the line 37 of your tax return? That's pretty much what it is, what they're looking at. So.
So speaking of cost, one of the questions that we've gotten from a number of clients is they've been on an employer plan and they might have dependents, children, a spouse or otherwise, and they've looked at the Covered California plans or the new ACA plans for an individual, and those are less expensive. But before they make that switch, what are some of the nuances there? Obviously, cost isn't the only factor, but how do you approach that?
Yeah, I mean, one thing to be aware of, if your dependents, your spouse and or kids are eligible for your group coverage, technically they can't sign up for tax subsidies. If you're eligible, you don't have to be signed up, you just have to be eligible to sign up. That's supposed to make you not eligible for tax subsidies at all. The advantage that group plans have is several. One is that they have the better networks, so you can get the full network of the carrier, where you only get the smaller network on the individual side. So that's usually that means they're willing to pay those providers a bit more, so that makes the plan a little more expensive just because the insurance carriers' costs are a little higher. You can also get the better formularies where you can get the better drug lists on the group side. Another thing is if you're a small business, you don't have to worry about open enrollment for individual. You can sign up as a group at any time you want of the year with the carriers, so you don't have to wait till November 15th. You can set up a plan any time of year. You can move to another carrier any time of the year. So you have a lot more flexibility in terms of plan design, plan options, just the flexibility, it all works together. And the other reason why, cover individual plans can be less expensive is if you qualify for tax subsidy, that's going to obviously help you right there. If you don't qualify for tax subsidies, it's going to be more expensive. But if you do qualify for the tax subsidies in your individual plan, definitely could be cheaper.
Well, also on the individual side, because of the pricing differentials or price compression, are younger people, because they're being rated on their age versus being in a group plan where there might be some other nuances, does that impact?
Everybody's being charged based on the age of the person, both on the small group side and individual side. So
shouldn't be a factor.
There's a 3-to-1 compression where the youngest age person can't be any different than 3-to-1 ratio than the oldest person, like say they're 60. So that applies to individual and small group. It doesn't apply to large groups. So if you work for a big company, a lot of the stuff we're talking about doesn't apply. This is really, Obamacare and ACA really is affecting the individual marketplace and the small group marketplace, which right now is 1 to 50. It's going to go to 1 to 100 in another year.
Wow.
Yeah.
let's begin to move into Medicare. And before we do, I just want to check and see if we have any questions here. So let's see. Jim, why don't you talk about how is Medicare affected by the Affordable Care Act?
Actually, very little. There's very little overlap. I mean, there's a couple modifications that ACA made to Medicare. It's like if you're on Medicare, like the Part D plan, the drug program, there was the infamous donut hole where you had to pay all your drug costs for quite a bit of time. ACA actually implemented to where the drug companies were going to subsidize half of that cost, and it's going to get phased out. So the donut hole is going to go away by like 2019. So that's actually favorable. That's actually a good change. There were some tax changes that affect Medicare Advantage plans where they didn't want to pay the plans quite as much as they were before, but overall very little effect in terms of what the average person would see. So you aren't really affected by ACA much with Medicare. One thing you're going to find is actually open enrollment, supposedly for ACA, is supposed to be starting next year. It's going to be supposedly October 15th to December 7th, which is open enrollment for Medicare D and Medicare Advantage plans. We'll see if that really happens, because that's going to be even compress it even more, and I don't know if that's going to be a good thing
for carriers to be able to handle that.
Exactly.
We did have a question, and it was someone who's a resident in Arizona, and we were talking about Covered California, and the question was, do other states have similar plans to a Covered California? And my understanding is each state is different.
That's pretty much correct. Some states have set up their own exchanges, like California. I think about 2/3 of the states are using the federal exchange, which is healthcare.gov. That's the federal exchange,
and that was the exchange that had a lot of problems with the website. California was sort of ahead on that curve, although
to some degree.
Okay.
they had their technical issues, and it crashed a few times, but I don't think the problems that they had were as severe as what the federal website has done. So
if you're living in another state other than California, check with a local provider. Your state might have an exchange.
Right. Yeah, you should. If you find a broker in that state, they should be able to walk you through if there's an exchange in that state or not, or if you have to go into the federal exchange. So
great.
I'm glad we had Cover California. My life is a lot simpler because of it. If I had to deal with the healthcare.gov, I don't know if I would still be here.
More complex. So coming back to Medicare, who's covered by Medicare, and how does that work?
Okay. Well, Medicare basically is available. Most people on Medicare are age 65 and over, but you can be under 65 if you've been on SSI disability for 2 years. That makes you eligible for Medicare A and B. But most people sign up when they turn 65, but you can sign up later. We'll talk about if you have a group plan, you don't need to sign up for Medicare when you turn 65. One thing to be aware of, if you're on Medicare, you cannot sign up with Cover California and get the subsidies and all that. They're
two different plans.
Two different things. And so once you turn 65 and go on Medicare, Cover California subsidies are not
drop off.
Yeah.
And so speaking of Medicare, we have a nice slide here that talks a little bit about the differences in Medicare. I know that we're going to drill down into each of those pieces, but high overview here of the different parts of Medicare.
Right. So like Medicare, most people have Medicare A and B. Medicare A is mainly hospital charges, some hospice charges, all that, most of the things related to being in the hospital. Part B is doctor's charges, outpatient services, some preventive services. Those are Part B. Part C is actually all the hybrid plans. It's Medicare Advantage and Medicare C are the same. So if you see Medicare Advantage, it's just referring to C. They're mainly HMO plans like Kaiser. Medicare Senior Advantage Program is a Medicare Advantage plan. Seniority Plus with Health Net was a Medicare Advantage plan. Basically, those plans are different in the sense that the government gives those carriers X amount of dollars a month for people who sign up with them. So instead of Medicare paying the claims, they pay the carrier to handle all the claims for those people who are enrolled in the Medicare Advantage plan. So basically, so most of them are HMOs. You might find a PPA here and there, but the HMOs are primarily. And then Medicare D is the prescription drug program, and that's basically anything you pick up at a pharmacy or get through a mail order. That would be your Part D. Some of the drugs that if you had to go to a doctor's office to get an injectable, it actually falls under Part B. So it depends on what the drug is. So if anything you get at a pharmacy is usually going to be under Part D. Now Medicare Advantage plans are A, B. Part D is usually built into Medicare Advantage plans, so you don't need to buy a separate Part D if you're on a Medicare C plan, and you don't usually need to buy a supplemental plan either. But if you have a Medicare Advantage plan, you can't buy a supplemental plan.
So you're using a few of these terms: Medicare Supplemental Plan, Medigap, Medicare Advantage. There are some nuances there, but what are the differences between these?
Between Medicare Supplements and Medigap, they're the same. They're interchangeable. So some people use Medicare Supplements and use Medigap, but it's the same thing. So
same thing.
Right.
Interchangeable.
Right. But Medicare Advantage is the Medicare C, so that's a different product altogether. And so you can either have a Medicare Advantage program or you can have a Medicare A, B supplemental plan and a drug plan. And
that's the more common option.
Yeah, I think statistically about 25% of people are on Medicare Advantage plans these days. They're appealing because the reason why people go on Medicare Advantage is lower rates. Because if some areas Medicare Advantage plans have no premium at all. The carriers get paid so much by the government, they don't need to have you pay a premium to them.
And that's state specific.
It can be state specific, it can be county specific. Like if you were up here, you don't find many of those plans. If you live in Southern California, there's a whole bunch of those zero premium plans. It has to do with the reimbursement the government provides to the carriers in that area. So it's very, very fractured. You might have 3 plans of Medicare Advantage in one county, 10 in another county. So you have to it's all based on where you live.
So again, either going online or finding a broker in your area that can help you navigate that process. You talked a little bit about the notion of some of those plans might be covered by the local county or that particular state, but going back to Medicare, how much does that cost? And we're going to go through, I believe, a couple different charts here, and this one talks a little bit about the Part B and Part D premium through Medicare. One of the questions that we get from clients, or perhaps an assumption that's made, is, okay, I'm turning 65, I'm moving on to Medicare, I'm no longer going to have to pay for my health care. And so that's been an interesting process for us, really having a better understanding of what are the costs of Medicare.
Right. There's for Part A, usually most people have no premium. That's just the way it's set up. For Part B, depends on what your income is. It can be as low as $104.90. That's if your income as an individual is $85,000, or as a couple is under $170,000 based on 2012 income. So that's the lowest Part B. But it can be as high as $335 if your income is like $428,000 for a couple. So there's like 5 different tiers of rates for Part B. So the government gets information from IRS, and Social Security can determine which category you fall into. I think there's an appeals process. You can file a form and say, hey, 2012 isn't representative of what I'm making today. So then they could reconsider and all that. So you might get the lower number based on that.
So if you're turning 65 in the current year and you've maybe just retired within the last year, Medicare actually, or Social Security, looks back at your 2012 tax return. So if there's an anomaly there, 2012 you were working, you were in a high tax bracket, 2013 you moved into a lower, or 2014 moved into a lower tax bracket. So working to fill out the form, submit it, and then you're eligible for those lower premiums.
Right. So you'd have to just file
the form
with the Social Security, and then let them decide. So that's also true. The same income levels also applies to Medicare D plans. There's actually, if you're high income, there's actually a high income surcharge that is payable to CMS. It doesn't go to the insurance company. So the CMS bills you for Part B, but also bills you for the Part D excess.
And CMS is California?
No, that's the Centers for Medicare and Medicaid.
Got it. Thank you. Jargon.
Right. And then you still pay a premium to the drug plan too. So you may have 2 charges related to your high income. One goes to the insurance company and one goes to CMS.
Okay. And then on top of the base plans, Part B and Part D through Medicare, then often people will layer on a Medicare supplemental or a Medigap plan.
Correct.
And this is a nice chart here too. There's a lot of detail. When you show this chart to clients or as you talk about this, what are some of the key highlights here?
Well, I'd say I always tell people F is the best plan.
Okay.
It covers pretty much all the gaps because Medicare A and Medicare B have certain gaps in them. And so
those are the base plans, and these layer on top.
So some of the plans fill in some of the gaps, but not all the gaps. So if you want the one that fills in all the gaps, you do F.
Mm-hmm.
And price-wise, it's still very inexpensive. I mean, a lot of my clients who are on individual plans were paying maybe $1,000 a month, if not more, for their plan. So F plan can be $130, $145 just for F, and then for Part B and all that. So if you want trying to shave your cost down a little bit, you can go to one of the other plans. But I'd say 98% of my clients do F. And because one reason you do F is that if you can't have that taken away from you. If you start with a lesser plan and then a couple years later you have some health problems, you want to upgrade to the better plan, you have to go through medical underwriting, answer health questions to qualify.
So that's interesting. I don't think I realized that. So if you're in Medicare and you've elected one of the supplemental or the Medigap plans, and then you're looking to make a change during open enrollment in a future year, you have to go back through an underwriting process. So there's still underwriting for Medicare, but not for individual health insurance pre-65.
But it's not open enrollment doesn't really apply to Medicare supplements. There's something in California called the 30-day rule. So there is actually open enrollment for supplemental plans 30 days from your birthday. So you can change to a like-to-like plan or a lesser plan. So if you're on F with Blue Shield and say you want to go to F with the United Healthcare AARP's plan, you can do that those 30 days, no health questions at all.
And that's on an annual basis, within 30 days of your birthday.
Right. But if you're on a lesser plan, say a high deductible plan, which has like a $2,000 deductible first, you want to upgrade to the better plan, you have to answer health questions to bill upgrade. Even at open enrollment, that 30-day window, that only allows you to go to apples plans. You can't buy up without going to underwriting. So I always tell people it's easier to start with F. If you want to go down, you can do that very easily. But if you want to go up, people who want to go up typically want to do it when their health changes to the negative side, and that's when it's a lot harder to do it because the carrier can say, it depends on what the issues is, he may not let you do it.
So yeah, that's a good tip. So starting with F at the point that you're initially enrolling in Medicare, and then if you want to make changes later, you can.
Yeah, a lot of people get confused because you can see on the supplemental plans it goes A through N. But also there's Medicare A, B, C, and D, and people confuse the two. And so because they're both letters and all that, but it's really Plan F is the Medigap or Medicare supplement. It's Part A or Part B with Medicare.
So really it's a base plan, and then these layer up on top.
Right.
Yeah. So going back to that initial question that I had alluded to, we do have a lot of clients who ask, so how much is this going to cost me? I'm now moving on to Medicare. What might I be paying?
Right. Example being, if say you're in the low income category, say the 150,000, a couple that put you in the lowest category, you're going to pay nothing for your Part A. Part B, you're going to be $104.90. You're going to have your Part D of your drug plan, which can be anywhere from $20 to $100, but the average person is probably $30 to $50. And so it's going to probably all net out somewhere around, and your supplemental plan, which is also based on your age, but it's going to be probably starting off around $130, $140 a month in that range. So I always tell people you're going to be somewhere around probably $275 to $300 a month if you're in the lowest income category. So that looks a lot better than someone who's spending $1,000 a month on a $5,000 deductible plan. So it's kind of it's a brainer. The one advantage of turning 65 I tell people is you're eligible for Medicare. I can't think of any other good reasons to turn 65 outside of that at this point. But even someone who's higher income, if you're making over $428,000, you're in the highest category that you can be charged by. And then so your Medicare B could be as high as $335 as an individual for Part B. You have the high income Part D, which is like another $69. Both of those go to CMS, and then the insurance company still charges you the premium for the Part D plan. So that's that 30 or 50, whatever your plan you're on. And the supplemental plan, there's no high income surcharge for that. It's the same rate as whether you're, no matter what you make income-wise. So so you're going to spend probably around $600 at the max under the high income scenario.
So maybe as low as $275 or $300, as high as $600, and that's per person. So if you're a couple in a high income bracket, you're looking at about $1,200 a month.
Yeah, I've had people who are over 65. They're working for a company, and you kind of have to do the analysis of looking at, and if they're still high income, it may be actually better for them to stay on their group plan because of the high income surcharges. It all adds up, and sometimes it's a better deal to stay on the group plan as long as you can.
Mm-hmm. So. And that, I think, weaves nicely into this next question. So if you are working for an employer and you turn 65, are you required to sign up for Medicare? Should you sign up for Medicare?
It depends on the size of your employer.
Okay.
If you work for a large company, which in this definition is 20 employees, it's not that large, but Medicare is the primary payer for small groups under 20. If it's over 20, the group plan is the primary payer. So you don't need to sign up for A and B. There's no downside to signing up for A because there's no premium anyways. But Part B does have a premium, so there's no reason to pay the Part B premium if your company plan is your primary payer anyways.
So if you're greater than 20, you should go ahead and sign up for Medicare Part A. You're not required to enroll in B.
If you're on an HSA plan, you don't want to sign up for either A or B because if you're on, once you sign up for even A, you're not eligible to contribute to an HSA plan anymore.
So that's a good tip. Yeah. So if you're participating in an HSA through your employer, you're post 65, don't sign up.
Exactly.
If your employer is more than 20 people.
Right. If your employer is under 20, the Medicare is the primary payer and the plan is secondary, but the carrier is assuming that you're signed up for A and B because they're not going to pay things that should be covered by Medicare.
So if you weren't signed up, you would have a gap.
Yeah, so you should sign up for A and B if you work for an employer under 20 employees. One thing that I've had a couple of people do this, they're on COBRA and they're over 65. They should sign up for Medicare A and B and get off the COBRA for themselves because
why is that?
If you're on COBRA, that's not considered. You can't waive your Medicare B coverage because if you're on a group plan, you don't have to sign up for B, and that's fine. But if you're on COBRA, Medicare does not consider that as eligible group coverage.
For creditable coverage purposes. So
even though it's an extension of your group plan, Medicare doesn't consider it a benefit that you can waive off. And actually, if you looked at the numbers, you'd be much better off on Medicare A and B in a supplemental plan than staying on COBRA. I had one client, he stayed on it because his wife needed coverage, but each individual has their own COBRA rights, so he didn't need to stay on it. She could have taken COBRA and he could have gone on to Medicare and he'd been perfectly fine and would have saved him about $1,000 a month if he had done that.
So it's always worth it to look anytime that you're eligible for new coverage, i.e. you've turned 65, you've terminated employment, you're bringing someone on or off the plan. It's good to look at what are all the different options available.
Yeah, it gets confusing, and I mean that's why actually there are brokers out there to hopefully to give you some guidance of what's the better way to go. It's not always obvious. Medicare seems kind of straightforward to me because I do it all the time, but for the average person, it feels very confusing, and so I find that people are better off using a broker. There's no cost when you work with a broker. Everything, all the commissions I get are from the carrier. They don't come from the client at all.
So the plan charges the same amount whether you're going direct to the carrier or whether someone comes to someone like you, and then you're able to look across all the different plans and say, based on this circumstance, here's the coverage that I'd recommend.
Right, exactly.
And so speaking of that, so how does one sign up for Medicare? So obviously you can go to a broker. The other question that I would have is, am I going to receive something in the mail pre my 65th birthday? How do I sign up for Medicare, and how will I be notified?
Right. Well, you won't be notified by Medicare. I mean, when you sign up for Medicare A and B, you have to go to Social Security Administration. The easiest way to do it is going to the website of either socialsecurity.gov or you can go to medicare.gov and sign up that way. And you can go into their office or you can give them a call, but online is probably the simplest way to do it, the most efficient. So the brokers are not involved with that process at all. Medicare will not even talk to brokers.
Okay.
They only want to talk to the person who's actually insured and all that.
So you have to first go and sign up directly through Social
Yeah, so
Security.
you need to sign up for A and B, and then once you sign up for A and B, then you can either sign up for the supplemental plan and the drug plan, or you can sign up for Medicare Advantage. You have to have A and B even for Medicare Advantage. If you sign up for Medicare Advantage, you cannot drop your Part B premium. You still have to pay that $104.90 or whatever your number is.
Okay. And I do want to talk about the Medicare enrollment dates. This slide here talks about Medicare initial enrollment. So at the point that you're turning 65, you can sign up at least 3 months before or 3 months after.
Correct.
So you have about a 6-month window.
One thing about, if you're drawing Social Security checks already before you turn 65, they'll enroll you in Parts A and B automatically. So you don't have to enroll for A and B if you're drawing checks. So you're kind of in the system already. But if you're not drawing checks, you need to initiate it. I don't think you'll get a notice from Medicare saying you need to sign up. They don't work that way. So, and I a lot of times I call my clients and say about 3 months out, saying this is the time you need to start to get signed up for Medicare. And you can sign up if your birthday, say, is September. You can sign up to 3 months before your birthday month. You can sign up your birthday month, and you can sign up 3 months after your birthday month. Okay,
so you have that window.
Right.
And then what about the Medicare A and B, C and D, and then the Medigap plan? Touch on that briefly in terms of the Medicare open enrollment dates.
Okay. For Medicare, A and B we kind of talked about already. That's that 7-month window. If you miss your 7-month window, you can sign up for A and B during open enrollment, which is the first quarter of the following year, and it's effective July 1st of that year. I've had a couple people, like people on COBRA, Medicare isn't recognizing that as eligible waiver, so they say you missed your enrollment period, you have to wait until open enrollment, and then you get it July 1st.
Although, let me ask this, so if you're on COBRA, you miss your open enrollment plan, you have to wait. If your COBRA period ends, that would be a qualifying...
Not for Medicare, no.
Interesting. So you really do have to manage that if you're on COBRA and moving on.
That's why you don't want to be on COBRA when you're over 65.
Okay.
You always want to get off COBRA.
Okay.
For Medicare C, which is Medicare Advantage plans, and D, the drug program, open enrollment is October 15th through December 7th.
Okay.
That's the same every year. So you're allowed to change your Part D plan. You can change your Medicare Advantage plan. You can go to Medicare Advantage from Medicare A and B and a drug plan. If you decide I want to go over to Kaiser or whatever Senior Advantage plan, you can do that at that time. So that allows you to do that. So Medigap, the more Medicare supplements, open enrollment is that 30-day birthday rule. Or there's other qualifying events too, like if you have a loss of coverage, you can sign up for a Medicare supplement. If you lose your group benefits and all that. So there are certain. But triggers.
Not COBRA.
But COBRA actually, yes.
Okay.
But you're already in A and B to do that. So the issue is if you're not signed up for Medicare A and B, the COBRA is a problem. And it's not so much getting the supplemental plan, it's getting A and B.
Got it. And I'm just taking a peek here. We do have some questions from the audience, and while I take a look at those, this is an important piece here. If you're on a Medicare plan, especially Part D, do you need to make changes during open enrollment, and how might you do that?
You don't have to. If you choose not to change it, it'll roll over unless the carrier sends you a notice start of September that the plan you're on is being eliminated. Then they'll move you to another plan if you do nothing. So you won't lose coverage, but you may get moved to a different program than what you started with. But if you're on Medicare D, what I do is clients give me their prescriptions. I put them into Medicare's website, and then it runs all 34 plans that are available in California, best plan, the worst plan in terms of costs and all that. So that's kind of saved in the Medicare site. So you can actually go in, and there's a password, and so you can go and change your prescriptions as appropriate for the following year. So like the plan information for 2015 will be out as of October 1st. So people can go in and open up, or they can send me their information. I'll go there and we'll change the drug data in the site, and then it runs the 34 plans or whatever for next year and what's best to worst. And if it's still a good plan you're on, we don't do anything. If you've had a significant change on your prescriptions, or the drug plan changed the plan significantly that adversely affected some of the drugs you're on, then you might want to change them. So it's prudent probably to evaluate the Part D plan. Some of it's Medicare supplements, they're pretty similar, all the carriers, because like Plan F is the same with all the carriers because the government determines the benefits. So F is F, you're not tied to the network, so the carriers anymore. But the drug plans, I have a lot more people change their drug plans because they change their drugs all the time, or the plan change with how they cover it, and they may cover it favorably this year, and next year they may cover it less favorably, and maybe another plan was covering a key drug more effectively.
So if, and you made a reference to looking through the 32 different plans. So in California, there are currently 34. 34, okay, right. 34 Part D plans, and in a given year or switching over into the next year, if you're taking a particular prescription, that could drop off your current plan, or there may be a change in coverage around that. So going in during the open enrollment period, entering in one's drugs that they're, or prescriptions that they're taking, they might want to make a change in plan.
A drug plan may come out with a new plan that treated your drugs very favorably. But, you know, I'd say most people don't change, but there's always a few people that do. And statistically, most people don't even look at it, really. They sign up, and I'd probably say 90% of people don't do anything.
Okay. But it's always good to go back and check.
Right.
It looks like we're at the point for questions, and we had a few that came in. The first was around, we were talking earlier on the individual plans that are now available and some of the pricing differentials between individual plans versus a large group plan. You may have touched on, but talk a little bit more about the small group plans, specifically for people who are self-employed. And a question came up around, why are these plans sort of discriminated against, i.e. the pricing is so high?
Well, the way they calculate the rates for large company plans, which is over 50, they have more numbers, but they blenderize all the ages of the people. So whether you're 25 or 55, it's the same rate, no matter, you know, for the same plan. But under an individual and small group up to 50, it's all based on the age of the individual. So you're going to find a lot of times someone who's in their 50s, statistically they're going to have more medical claims anyways, and that reflects in terms of the rating and all that. So I mean, a lot of times I have people who are leaving a large company plan, they're being offered COBRA, and they've heard COBRA is really expensive, but actually it may not be, based on if they're like in their 50s or early 60s, the COBRA deal may be a lot better deal than going on individuals. So you have to look at all those factors to decide, is the COBRA the better deal, or is going an individual better deal, or is a lot of times Medicare if you're 65. So.
And do you have any advice for someone who might be self-employed or may have a small business, let's say a husband and wife, so they're, I guess, considered a small group plan, and you did touch on last year what's called I believe the shop exchange, where small employers can go, but briefly, do you have any advice for people who might be self-employed?
Right. Well, one thing to be aware of, that the husband and wife group cannot be a group anymore.
Okay.
So if you
that's
were to go
change.
that's a change of the state law change last year. So if you go to a carrier as a husband and wife, whether you're a corporation or a sole proprietor, they won't take you as a group.
How many qualify now as a group?
Well, you can qualify as one, but you have to be, if you're like a sole proprietor, you have to have a W-2 employee to be eligible to sign up.
Okay.
So if you have one W-2 employee that's a non-spouse, that's the key.
Okay.
It could be a kid. If you have a kid, it's okay.
Okay.
But the spouse, they won't accept that.
No longer considered a group.
So you can do a one life group if you have a true W-2 employee. It can't be someone on 1099. It has to be W-2 where they're taking out taxes and all that.
Okay.
So that's a big change. So I guess part of the reason is that husband and wife groups can now buy individual policies because everything is guarantee issue. Before, a lot of husband and wife groups did group plans because they could get guarantee issue, but because they had a health problem, they couldn't qualify. Now, qualifying is not a problem. So, I mean, there may be other problems going individual, but they can't be declined due to their health history anymore. So,
got it. Let me just see. The last question, or the next question that I think will be our last question today, we're going to wrap up here, is you referenced earlier, we were talking about working with a broker to be able to look at coverage? What are the different options? The question was, is there a way, or how to identify a good broker, and is there any sort of B2B or business rating system or otherwise to identify a broker?
There's no rating services like in that respect. I think someone who, like I have an RHE, which is a registered health underwriter, and I have REBC, which is a registered employee benefit consultant. So I've gone through quite a few classes to get those designations. So someone who's got those designations probably is more committed to the business. But you need to find out, what do they specialize in? Some brokers maybe specialize in large groups. So you really need to find out how long they've been in business, what their educational background is, but also where they specialize. Like I specialize in individual Medicare and small group because they all kind of go together. Large group is a completely really different business.
Different animal.
I'm not equipped to handle that side. So, you might get a referral from someone, but if they are a large group specialist, they may not be much good if you need Medicare advice. So.
Yeah, and I'd say, when we're looking at working with brokers like yourself, understanding, as you said, who they're working with, but also the types of carriers that they underwrite with. So using a broker who has access to multiple carriers, not necessarily tied into one carrier.
Right. If you're tied to one carrier, I wouldn't consider them a broker.
Right, or just a few carriers.
Right.
So having a more expansive ability to look across carriers.
Somebody specializes in health insurance, like I don't do securities. My firm is Holt Financial Services. I don't do any financial services anymore, so that's a misnomer in that respect. But health insurance takes a lot of time and energy to stay on top of it and all the law changes. So you don't want someone who does a little bit of everything because they just can't buy time to be as knowledgeable just because it takes time. So.
Yeah. Well, I wanted to thank everyone in the audience for attending today, and also, Jim, thank you for joining us. This has been an enlightening hour, and before we leave, I would just like to remind those of you in the audience that today's webinar will be available online following the presentation, and we invite you to attend our October webinar, which will be taking place the third Thursday of the month, October 26th at 11 a.m. More information can be found on our website at mosaicfp.com/events. We look forward to providing you with more useful financial pieces to help you put together that mosaic of your life.